welcome back to the Dean Obeidallah show. Right now, very happy to welcome to the show Dr. Tanya Haj-Hassan, a pediatric intensive care doctor, works with Doctors Without Border, another organization, been to Gaza many times, most recently with Medical Aid for Palestinians, and a co-founder of Gaza Medic Voices. Doctor, thanks for being on. I appreciate you being here.
Thank you for having me.
Sure. So, you've been doing amazing work and heartbreaking work. I can only imagine it's difficult just to speak about what you've seen and the horrors to people living in Gaza, to also fellow healthcare workers. Can you share for how many times have you been to Gaza, and what's the most recent time?
Yeah, I've been repeatedly over the past over 10 years now. We would usually go and teach medical students and young doctors. We try and go about once a year, and then more recently, I've been in the context of the current war. I went in March, and I was meant to go about a week ago now, but they had to shrink the size of the team going in due to the security situation.
And what was it like? It's interesting you've gone there for so long, not just during this conflict. In recent years, before the conflict began, what was the healthcare infrastructure like in Gaza?
It's a very good question. So the healthcare infrastructure was, I guess the most accurate way to describe it is resilient, much like the population, in the sense that despite the 17-year siege, despite all the obstacles to getting things into the Gaza Strip, the healthcare providers had made a very impressive effort to create a tiered healthcare system with subspecialty hospitals, referral systems, and they could care for most things. There were some things that they weren't able to provide care and would try and arrange evacuations for. Often those evacuations would be rejected by Israel, and at times, when approved, the patients would get evacuated to be treated elsewhere. With the healthcare system itself, there was a pediatric hospital where I used to work. That hospital has since been besieged, evacuated, and partially destroyed, and so is no longer functioning. There's an eye hospital, psychiatric hospital, a cancer hospital that as well has been besieged, partially destroyed, and is no longer functioning. There are two very large hospitals. The largest hospital in Gaza was Al-Shifa Hospital, or Al-Shifa, which means to heal or healing. It was the major, I would say, about quaternary hospital, so it gets all the referrals in for the more complicated cases. It was also the major trauma center for the entire Gaza Strip. That hospital was besieged twice, bombed, invaded, and most recently destroyed to the ground. And Al-Shifa was a very large hospital complex consisting of multiple buildings for the different specialties provided there. Now, the second largest hospital is in the south. It's Al-Nasser, which you may have heard about quite a bit in the news of late. And then there are multiple smaller Ministry of Health hospitals, like Al-Aqsa Hospital in Deir al-Balah in the middle area, which is where I was based, which prior to October 7th would have been one of the smaller hospitals that refers the more complicated cases to Al-Shifa Hospital. But unfortunately, because those larger hospitals have been destroyed and have been put out of function, Al-Aqsa Hospital is now functioning as one of the main hospitals in the Gaza Strip, and probably, along with Al-Nasser Hospital, the two major trauma units for the entire Strip.
And again, because you've been there for years before, what can you share? What was life like for people in Gaza? Now we've read, 90% approximately have been displaced, sometimes numerous times. We see the most residential homes destroyed since World War II, according to the UN, in this conflict by the Israeli military, and people going from tent city to tent city. But before this, what was life like for people in Gaza?
So the majority of people that I've met in Gaza have never left the Gaza Strip. So born, raised there, the younger doctors especially, most of them would have never left the Gaza Strip. 2/3 of the Gaza Strip prior to October 7th were refugees from elsewhere in Palestine that in the context of displacement forced displacement had moved to Gaza. Gaza is a very densely populated strip of land. But Gazan people are people who love life. So despite those constraints on what comes in and comes out of the Gaza Strip, despite not having freedom of movement outside of the Gaza Strip, the population itself is people who really love life and are making the most of it under the current circumstances. And that goes. I can give you some examples of playing beach volleyball or with them, or my colleagues going for a swim in the sea with some of their colleagues, of people trying to join us on a morning run on the beach before we go into the hospitals to teach, of the lunches and dinners we were invited to on a daily basis because everybody wanted to share their food with us. So that's kind of from a more social standpoint. The people of Gaza are just very, very beautiful human beings who love life and who are making the most of their living circumstances. From a professional standpoint, our colleagues there were excellent physicians and surgeons and nurses who had. Many of them had never left the Gaza Strip, not for training, not for conferences, not for the things that your average healthcare practitioner around the world would have traveled for multiple times. People in Gaza have made the most to educate themselves in medicine and the practice of clinical medicine despite the circumstances, and were able to become excellent physicians, surgeons, nurses under those circumstances. And I remember attending Gaza's first evidence-based medicine conference and being very impressed, because most countries I'd been to had never had an evidence-based medicine most countries with limited resources had never had a conference like that. But the people of Gaza loved learning so much that they would, keep up with what was happening globally in the medical field, and then try and develop rigorous medicine internally despite the restricted access and resources.
No, and I so appreciate you, Doctor, you explaining that, because I want people to have more of a sense of what life was like before the current conflict, because all you see are images now. And I think they're even more heartbreaking when you realize it was a vibrant life for most people living there in the Gaza Strip and going
And
beaches.
Dean, I paint a really rosy picture, but I also want to be clear that the living circumstances in Gaza were deteriorating over the last 17, or at least the 10 years that I've been going in and witnessing it myself. I remember on the last time I entered prior to this year, crossing Erez and on the other side thinking, wow, there's a stench of sewage, and talking to some of my colleagues about it. And they were describing that because Israel only allows for certain hours of electricity to be provided per day, they're unable to operate the sewage plants and dispose of waste in a timely and appropriate manner. And I remember one pediatric case, so one child that died of disseminated bloodstream infection after he became sick swimming in the sea. They described the fact that they were unable to dispose of sewage, and that some of it had to be pumped into the sea, and that they were seeing multiple cases of people coming in unwell because of contaminated water that could not be purified in a timely fashion as a consequence of Israeli constraints on electricity. So the living conditions had certainly been deteriorating, despite the fact that people were trying to make the most of their circumstances and were still loving life and living it to the greatest extent they could.
And, and again, I thank you for that. And especially the fact that, people don't know about the limited electricity or the limited supplies allowed in by the Israelis through the years to people in Gaza, and not allowing and shutting off electricity and having control of it, and only allowing people to have it for a few hours at a time, whatever that might be, based on an arbitrary schedule by the Israeli government.
And they had normalized the violence too. I remember sitting in backgrounds in the mornings, these morning rounds where you discuss the cases that came overnight, and hearing bombing and feeling the shaking. This is years ago. This is not since October. And I turned to a colleague a little bit startled, being like, do I need to be worried? What does that sound? And they said, oh no, that's just the occupation reminding us that they're here. We're used to it. And a few nights prior to that, I was in my hotel room in Gaza, and it was the same thing. I heard bombing. I turned on the news to see what was happening, mainly because I was worried my family would hear the news prior to me hearing it and know that I was
Right.
there and get worried. So I turned on the news, and there was nothing on the news. And the next morning, I asked my colleagues at the hospital, did anybody hear the bombing last night? And they said, oh, yeah, they do that sometimes. It's just a reminder. And it turns out they had bombed a field near the hotel where I was staying. And my colleagues had described that being a pretty regular occurrence.
It's very interesting what's a regular occurrence, what people get used to. I went to visit my family in the West Bank, and they were used to checkpoints being closed and having to stand there for hours, which this is a New Yorker, an American. That's really opposite of, especially being a New Yorker with no patience. That's hard to get used to. And hearing, one night shots fired, and they're like, don't worry, that's just the Israeli military doing what they're doing in the West Bank. So it's remarkable what the human condition gets used to. And that when you're an outsider, you come in there and it's stunning. So now let's talk about, what happened out. You were there in March, you were saying, in Gaza. So you've seen what happened. You're a pediatric intensive care doctor. Can you share with listeners some of the type of injuries you would see with children who are coming in for care?
Yeah, absolutely. So I was working in the pediatric unit, so the pediatric inpatient unit, in the intensive care unit, which is an adult intensive care unit, but the majority of the beds were occupied by children who had traumatic injuries, and in the ER. But I probably spent the majority of my time in the ER because there were just so many mass casualties coming in on a regular basis, and the majority of casualties that we were seeing at the time were children. And so there was a need for my skill set down there too. And I wanted to support the staff because I knew they were very overwhelmed in the ER. And we would see, in a single mass casualty, you would have 10, 20, 30 people come in at least injured. And the way an ER is divided is usually most ERs, and particularly in the context of a mass casualty, you have a red area where the most critical cases are taken, particularly those that you think could survive their injuries. Then you have a yellow area where you have the more serious injuries, but that aren't immediately life-threatening. And then you have the green area where the injuries are are not life-threatening, and people can actually wait to be seen by healthcare providers. For the most part, we didn't even have doctors in the green area because we had so many patients that were red or yellow in their triage category of seriousness. And in the yellow, our red area would fill up within a few seconds of a mass casualty, and the rest of the critical cases that would normally be seen in the red area were just put on the floor in the red area or on the floor of the yellow area. And we would all be on our hands and knees trying to resuscitate the patients that would come in overwhelmed by this constant, endless stream of critically ill patients coming in with limbs blown off, skulls blown open. And for a lot of the cases, you take one look at them and you think, this is not a patient we can resuscitate realistically given our resources. And unfortunately, even for those patients that you cannot resuscitate normally in a functioning healthcare system, you would at least provide them with end of life care so that they don't die in pain, suffering. And we weren't even able to do that. One, because of the number of people that came in any one period of time, our focus would be on those that we could save. And two, because we were so limited in the medications that we had access to. Israel had severely limited what could come in and outside, what could enter the Gaza Strip. And so we had a shortage of all the essentials, including medications for pain relief and anesthesia and sedation. So we would have patients that we could not resuscitate because they had such devastating injuries. So children, my colleagues would often say, and I want to apologize in advance to your listeners, because I know this is going to be very graphic for many and difficult to hear, but we got quite accustomed to saying brain matter out, meaning we can see the brain matter and therefore we won't resuscitate this child. We can tell that this injury is so severe, and we would move on to the next patient. So we would have patients with exposed brain and skull injuries, children, and these are children, sorry, I should clarify. Children with parts of their face blown off. I had that on multiple occasions, parts of their neck, exposing the vessels in the airway and sometimes penetrating the main vessels of the neck. Injuries to the chest, including bleeding in and around the lungs, injuries to the abdomen, broken extremity, visibly broken extremities. I remember one little boy with both of his legs clearly broken at a high level and displaced. So they were kind of flailed. And I remember trying to reduce the fractures. So you have to do that quite early before the muscles spasm and to protect the surrounding vasculature and nerves. And we were normally, it's an extremely painful injury, a femur fracture, so the main long bone of the leg. And he had it on both sides. It's extremely painful. It's the sort of thing that you would get morphine at the door of the hospital door, or even in the ambulance, if that were seen in New York or in Canada where I was working. And this child hadn't received any analgesia, any pain control whatsoever. And I remember saying, can I have some ketamine before we reduce the fractures? And the team said, doctor, we don't have enough supply to use it on this. And it was so difficult to watch the excruciating pain that these children were in.
What were the ages of the children when you were talking about the children? Are they
this
toddlers?
This boy was probably around 8. I had a lot of infants, a lot of toddlers. I remember resuscitating 3 toddlers on one bed at one point. One was probably a little over a year. The other was 2. In fact, I didn't know any of their names or their ages because they came in alone. Till this day, I know that one of them, I think, lost both their parents, and the other one, we weren't sure where the family were or whether they had survived. I had inquired later because one of them died while we were resuscitating him, and I asked around to see if anybody knew where the family was so I could let them know. And they said, doctor, they hit the entire multi-generational family. We don't know where anybody is. And this was a common occurrence. So we saw, to answer your question, I guess specifically, we saw children with crush injuries as a consequence of being crushed under the rubble. We saw children with shrapnel penetrating wounds. So when there's a bombing or a missile strike, bits of metal and can be propelled in the air at a speed and penetrate the body the way a bullet would. So children with shrapnel injuries all over their body, children with burns, extensive burns at times covering the majority of their body. I remember one case of 2 siblings who had lost their entire family in the airstrike. One of the boys had survived, and his sister had over 90% body surface area burns. She was in the bed next to him, being resuscitated, and he kept asking about his family. He had had half of his face blown off, his neck. And he kept asking about his family and asking about his sister. And I didn't have the heart to tell him that that girl that he could see in the bed next to him was actually his sister. She was just burned beyond recognition. Wow. She died in the ICU about 2 days later. And so he survived. He's the sole survivor of his family, and had to receive extensive reconstructive surgery to his neck. So burns, extensive burns where you could smell the burning flesh of children when they would come in. We even saw direct gunshot wounds to children. I still, for the life of me, cannot fathom how anyone could shoot a child. Right. But the reality is we bore witness to those injuries, as did many colleagues in medical teams that went before us and after us. So those are the sorts of injuries that we were seeing, and of course amputations. You've heard that there have been more amputations in Gaza than pretty much any previous conflict of the same duration. I mean, it's just unfathomable how many children have lost their extremities. And then beyond that, we were receiving children coming in with hepatitis and pneumonia and gastroenteritis and dying of liver failure as a consequence of hepatitis that is a direct result of the unlivable conditions in Gaza right now. There is no effective means of disposing of sewage. no access to clean water. People are living in tents without access to laboratories. I can give you the statistics on this, but there are, over 300 people sharing one toilet, sometimes over 1,000, and definitely over 1,000 sharing one shower. And the majority of the latrines are non-functional. You can't imagine how these people are living day to day and are keeping themselves clean. And we know that they cannot. I receive pictures, consultations from my colleagues in Gaza of children with extensive skin infections as a consequence of the unhygienic living conditions.
It's a horrific hellscape that you paint. Chatting with Dr. Tanya Haj-Hassan, the pediatric intensive care doctor, works for Doctors Without Borders. Benjamin Netanyahu, the Prime Minister of Israel, spoke before Congress last week and said about civilian casualties in Rafah, there were, quote, practically none. From what you've seen through Gaza, you've painted a very vivid picture of countless, endless number of civilian casualties. When you hear Netanyahu lying like that before Congress, what's your reaction?
It's delusional. I mean, it's laughable. It's delusional. You have countless witnesses on the ground from different parts of the world, from different backgrounds, from all saying the same thing. Every humanitarian organization that goes in there says that this is the most atrocious thing they have seen. If you look at the demographics of the killed and the injured in the Gaza Strip, they mirror exactly the demographics of the Gazan population. How can you tell me that there are no civilian casualties when the majority of what I and every single person I know who has worked in the Gaza Strip in the healthcare sector is telling you that the majority of those that we see are women, children, elderly? We see a lot of young men too, but it mirrors the population demographics. And even the young men that are being killed, I can tell you about the young men I personally knew that were killed. They weren't militants.
Mm-hmm.
The majority of them are healthcare providers, and they weren't militants, and they had nothing to do with military activity. So to say that there are no civilian casualties is unfortunately delusional, laughable, and a flat out lie, and in direct contradiction to the realities on the ground.
Well, Benjamin Netanyahu doesn't view Arabs as human beings. I get my sense, the whole thing. So to them, there's no civilian losses because they're not human beings who have been killed. You talked about something that didn't get much press in America, the abduction and torture of healthcare workers, and that hundreds you've documented detained by Israeli forces. Can you share a little bit about that? Because I saw your interview in The Nation and it opened my eyes up to it. I was not aware of it.
Yeah. I mean, I'm hoping there'll be increasingly more coverage of this, because it's a reflection of detention policy in general. And I just want to be clear that this is not something that Doctors Without Borders is investigating or working on directly. So this is more my own experience of testimonies that I have heard personally. Of colleagues that I personally know who have been abducted, detained, and tortured in Israeli prisons, and the work of Healthcare Workers Watch that have been collecting these testimonies formally. We know that since the very beginning, healthcare workers are being detained, often from their place of work, by Israeli forces. They're being abducted. And they're describing, for those who have been released, they have been describing physical, psychological, and sexual torture in Israeli prisons. And the healthcare workers I have spoken to, both male and female, describe being called from the humanitarian corridor that was identified by Israel as the safe place to evacuate from north to south when they besieged the hospitals. Mm-hmm. They were abducted, evacuating patients from Al-Shifa hospital to the south. And they were called by Israeli forces, essentially, hey, you in the scrubs or you in the white coat, come here. So not by name, but by profession, come here. And subsequently taken to Israeli prisons, tortured, told that they were part of Hamas, told that if they didn't confess that they were part of Hamas, that they would be beaten, that they knew where their mother, family, children were living in the Gaza Strip, and that they would target their mother, family, children, that they would rape the females and their families. And then they were subsequently physically beaten, placed in conditions that are completely unfathomable. So hands tied behind the back, blindfolded, undressed, stripped naked down to their underwear, cold fans blowing on in the middle of the winter, loudspeakers and lights blasting 24/7, and then taken regularly to be tortured. They were fed a minimum amount of food. So these are their testimonies to us. And then they would be taken and interrogated and physically tortured during those interrogations, describing sexual and physical abuse during those interrogations. And these are healthcare workers who have been released as innocent. I cannot, and I just want to be clear, Dean, the testimonies that we've seen and that healthcare workers watch have collected, have described the same types of torture from independent inmates who've been released and who haven't had the opportunity to communicate with each other. So this is a systematic approach to healthcare workers who are held in detention. And, in terms of the crime that they're being allegedly held for, it's that they're part of Hamas when they clearly aren't, that they treat resistance fighters, that they have seen hostages in the hospitals when at least the couple that I've spoken to say that they have never seen an Israeli hostage in their life.
Mm-hmm.
And I think it's really shocking that this hasn't garnered more media attention. And I don't know if you'd followed the last 48 hours, but there had been a lot of controversy within Israel about the soldiers who had sexually abused some Palestinian inmates,
Mm-hmm.
and imprisoned or detained for that, and lots of people trying to free them, claiming that in fact it should be completely legitimate and legal to sexually torture inmates. So that's garnered a little bit more attention that I'm hoping will spread towards the conversation about the healthcare workers that are detained as well.
I hope so too. I mean, I'm more hopeful that perhaps European media outlets or European organizations will cover it more than American, just because of the local scenario that we live in today, where there's more criticism of Israeli policy than I've ever heard, but still it doesn't get into the nuance and detail that some European organizations will. Last thing, tell us about Gaza Medic Voices and, that you're involved in.
Sure. So I mentioned that I've been going to Gaza for over 10 years to teach. A lot of the medical students that I had taught years ago are now young doctors. I've also have close friends and contacts in the more senior medical sector. And in 2014, 2021, with every assault on the Gaza Strip, we keep in touch, and they tell us the realities of what's happening on the ground. And in October, when Israel first started bombing the Gaza Strip, we started receiving very frantic messages from colleagues there saying that it's worse than anything they've seen, and describing some of the attacks. In fact, I can pull up some of the first messages we received, and we received, tens, if not hundreds per day between myself and my colleagues. For example, this is a surgeon on the 12th of October saying, having spent 5 days without leaving the hospital, I find myself at a loss for words. Never before in my entire life have I witnessed anything like this, and I'm unable to articulate what I've seen. Another emergency medicine doctor was saying that they'd received more than 700 casualties at the same time in over 25 minutes, and that there was no space. They were dealing with patients on the floor. And then one of our colleagues, actually multiple of our colleagues, had sent us similar messages asking us to share their testimonies with the world, to let them know what was happening in Gaza. One of our colleagues sent us a message saying, "We need you and your colleagues to reach out to our scene of massacre to all the world. We trust you. Please be our voice outside. We need you to convey the voices of our pain and oppression. We need the world to see the real scenes that no creature can bear." And we got together as a group of colleagues who've been going there for many years and decided to start sharing these messages with the consent of our colleagues in Gaza on a public platform. Initially, we were naming our colleagues who were sharing these messages, but then when multiple of our colleagues were killed and some of their family members were killed as well, we became concerned that maybe healthcare workers were being targeted for bearing witness and testifying to what they were seeing. And so we started sharing their messages anonymously. And so we share the texts that we receive from them and in quotations, naming their specialty and the date at which we received it. And we share it on public platforms, Twitter, Instagram, etc. And we hope that, journalists, I was actually just on a call a few minutes ago with Dr. Mark Perlmutter, who's a U.S. Jewish American surgeon who recently come back from Gaza as well.
I read about it.
So he was essentially saying that we've become journalists, not by our own will, but because we are some of the few that are allowed to bear witness to the atrocities being committed in Gaza. And by virtue of being in that position, we're now coming on the media regularly trying to share what would otherwise be covered by journalists. But because international journalists, were banned by Israel from entering Gaza at the very beginning of their operation. And local journalists have been killed at an unprecedented rate. I'm sure you know this, but I think it's over 180 journalists, if I'm not mistaken, have been killed so far, the highest number killed in any war. We have started bearing witness ourselves in a way that we normally leave journalists to do. The same way we've also started investigating things, even though we're not investigators, because we bear witness to these atrocities. So this platform is seeking to bear witness through the voices of our medical colleagues. And, even within Doctors Without Borders, within MSF, hospitals, healthcare workers, and humanitarian workers have been under attack from the very beginning. Israeli forces have repeatedly bombed and raided the hospitals in which MSF works. They've attacked our convoys, detained our staff, bulldozed our vehicles. So far, approximately 500 healthcare workers have been killed to date that we know of in Gaza, including 6 of MSF's colleagues, MSF alone has had to flee 14 health structures and endure 26 violent incidents, about 3.7 violent incidents on average per month since the start of the war. So you're talking about an unprecedented level of attacks on healthcare, on humanitarian workers, on civilians, on journalists, on UN workers, and Gaza Medic Voices, as well as our work within MSF, this témoignage, this concept of bearing witness to the atrocities where we work, is a very important part of the work we do, and is critical in circumstances like these where journalists aren't able to do that, and media outlets are very selective in what they choose to report.
I agree, and I so appreciate you sharing this. I know it is emotionally challenging just to retell the stories of what you've seen. I can see it in the way that you describe it. Doctor, you're doing amazing work. I so appreciate you coming on the show, and I hope this conflict comes to an end sooner rather than later. Then if Doctors Without Borders go in, then I'd love to have you on again to share then what you see post-war and how the health system is functioning then, and if it's getting better for people. But stay safe, Doctor. I so appreciate your time and your insight and your expertise.
Thanks for having me on your show, Dean.
Sure.